working in the front lines of healthcare, the DTTB, and also faced with formidable challenges and frustration of systems problem that exist and are recurrent, complex and wicked. What can the doctors of the barrio do? Given the freedom of creative minds, the never surrender type of spirit we saw yesterday, 15 groups presented their solutions. These solutions were very innovative, and to think that you had only a short 2 weeks time to put everything together. You have to pat yourself in the back for a wonderful output because of what you did yesterday.
Hindi mahirap makatapos ng MPM sa ASoG. Kayang-kaya, pero hindi madali makapag-medal. We always caution our students that to take the title seriously, it has to be about governance or something related to governance. It has to have some kind of innovation, no? Something that you do. And of course, we all know that everyone in this room, all the students here, already have those innovative juices running.
The frame of your master in public management course is anchored on three major areas, which is ethics, politics, and economics, and of course, leadership.
What do we observe in this economic growth if we look at it on a per sector level? What we see is that on a per sector level, there's an unequal distribution of the growth of the wealth. But in terms of the sector, the share of the poorest sector, which is the agricultural sector, has actually been flat. So the economy has been growing, the rich has been getting richer, but in fact, the poor has been getting poorer. So where does this lead us? This leads us to drastic inequality. What are the policy recommendations that we can think of or we can suggest to reward the consumers to choose the products produced by social enterprise? This is now where I present you the present bill. Present bill is a poverty reduction through social entrepreneurship bill. It actually enhances support to different social enterprises to a social enterprise development fund. Aims to establish the Center for Social Enterprise Development, mandates the public procurement of social enterprise product.
So my research question was, how did the COVID-19 pandemic affect primary healthcare and the establishment of the healthcare provider network in the city of Baguio being among the advanced integration sites? I tried to identify the major challenges that they had and at the same time learn from them how they managed this. My thoughts during this study was, let's prioritize those who need it most. That's why I put market segmentation there and a digital system of empanelment that is regularly updated not only by the Health Services Office but in collaboration with your civil registry, your population office, City Social Welfare and Development Office, the barangays, and DepEd.
GIR is a management study of a public issue. It is oriented towards boosting value creation. Yung may mapapakinabangan. Sinasabi ko, lahat will start with identifying what is the issue. Marami tayong mga policy, marami tayong mga decision in the government, kaya hindi maganda sa implementation. It's because hindi na-analyze na mabuti ano yung causes. So that is what we would like to emphasize in your governance innovation report, that you should be able to first identify a very core issue.
We will now witness the 6 semi-finalists and what they are going to show us. Their objective is to showcase the problem and present to us how to make things better, because at the end of the day, it is about better health outcomes for Filipino. And I hope this will become a source of inspiration to all of us that indeed there are things bigger than ourselves.
This innovation is in response to the current problem regarding data management. And we found out that we have challenges, similar challenges when it comes to data management. To shorten our problem, we come up with our data there is the inefficient data consolidation with incomplete, inaccurate, and disorganized health data for disease surveillance and health services. Because we believe that problem solving and innovation should be data-driven and not gut-driven, that's why we're able to conceptualize this innovation, which is we would like to create a mobile application for disease surveillance and health service data capturing, processing, and analysis and reporting. Target the health workers assigned to specific medical fields such as the disease surveillance or the meso personnel, health service reporting or the FHSIS personnel. So those are our target users. There should be a multidisciplinary and multi-stakeholder coordination, knowledge sharing, and team effort. With iDeserve app, I believe that data management need not to be difficult because iDeserve a hassle-free work environment. So iDeserve app innovating towards health betterment.
In our current situation, we don't have the ideal ratio of human resource for health. Have to think, how can I maximize my limited resources? So how? We want to create this proposal to have an application specifically for BHWs. And we want to call it the BHW Connect. It's an app that that can capacitate them with the basic skills. It's an app where they can use as a resource to gain knowledge as well, and to go back to what are the things that were taught to them, and eventually to go back to relearn those things, to guide them to what to do. So how do we operate with this one? It's going to be owned by the Department of Health. It has to be standardized. With the collaboration of different stakeholders, we will ensure that the information in that application is guidelines-based, evidence-based, and based on the medical practitioners' practices as well. BHW Connect, it is a community-engaging, community-empowering app. Let us use this app to bridge the gap para ang UHC ay may palaganap. Because we do believe that there is power in every single BHW.
1/5 of the population are adolescents. Although they are perceived to be healthy, they are the most vulnerable and we must protect them. So is healthcare really inaccessible to our teenage population? The simple answer is yes, by a survey and a research conducted in 2019. Different factors such as long waiting time, inappropriate or negative healthcare provider attitudes, high cost of these services, and of course, and most importantly, taboos, cultural norms, and stigmas surrounding these issues.
First is to provide an avenue which is comfortable enough for the youth so that they will be able to access information on mental health and reproductive health. The second is to also provide an avenue to address common queries of the adolescents. The third is to improve access to counseling and consultation services and emergency services. And lastly is to provide screening tools and advice on anxiety, depression, and substance use. This application is aligned to the mission of the universal healthcare to provide immediate eligibility and access to preventive, promotive, curative, rehabilitative, medical, mental, and emergency health services, which serves as a bridge to teleconsultations or primary healthcare facilities as deemed warranted. But we know that the complexity of sustaining such an application is just crucial, so we have to have a multi-sectoral collaboration. So with that, we again introduce you. Bridging gaps.
Securing the future.
We made it. Youth can do it.
Have you ever dispensed a drug that is about to expire? Where is the bottleneck? We trace its roots on faulty procurement planning. Wouldn't you want a way to use the relevant data that we already have, make it simpler, make it more user-friendly, and make it accessible for both end users so that they can see it real time? So our health innovation is something that uses the data on pharmaceutical products and supplies and make it more accessible, which will give you, of course, the convenience now of monitoring them. And what's more is that you can see the amounts real time, both end users. And now you can also see the data, use the data, and forecast the supplies that they need and guide succeeding procurements. Ladies and gentlemen, I present to you ILEA, the Integrated Logistics Express Access for Health.
This is what we would like to see. Kung mag-type sila ng gamot dun sa search bar natin, lalabas lahat ng data ng lahat ng health facilities natin para matrack nila yung mga facilities na binigyan nila, matrack nila kung anong facilities ang mabilis gumamit ng gamot at kung sino pa ang dapat nating bigyan ng mga gamot.
Blood donation sa Pilipinas, malaking problema talaga. Kaya ang nangyayari, kulang ang dugo. Hindi maibigay yung needed units para ma-save yung pasyente at that time, no? May delay in care. So, isa pa is lack of technology. Walang transparent and publicly available data on the current available blood in blood banks. Walang centralized registry. So, now we develop the One Blood Sample Source System, a centralized provincial blood registry blood network system. We are using the free existing and widely used online platforms. Kaya we'll be using Facebook page, group, messenger, and we will be utilizing Google Forms and Sheets. Kasi alam ng health workers paano gawin to. Then ito, mag-consolidate ito sa Google Sheets. Mag-encode yung mga RHU. Makikita ito ng blood bank. Si blood bank ang ating main coordinator nito. We also want to tap the already existing Facebook Social Impact Initiative. Merong blood donations feature. Pwede tayong mag-register doon and they will inform all the areas na malapit doon sa blood donation drive na mag-set ng reminder na merong blood donation. So we can tap on that. We need to institutionalize a province-wide blood network system through multi-sectoral collaborations. So our end goal is to supply the needed blood units without the need for donor replacement throughout the year.
And there was this, and until now, sadly, unequal distribution of our public health practitioners across the country. The awareness has been increasing over the years. We have started professionalizing our public health profession at yung mga ginagawa natin ngayon in terms of public health. Yung bar natin, we have raised it already. This kind of activities and this kind of learnings raises the bar furthermore. So you are all lucky right now that there is already a program being provided by the Department of Health so that you, our doctors, would be more inclined to work for government, to work for our communities, to work for our people. The way to go right now is for all of you in our communities to be able to impart to our communities the value of their health and for them to be able to have good health behavior. In health outcomes between and among regions of our country would soon be reduced. That is our goal and that is our aspiration. And I hope that you also put that as part of your aspirations, being one with us as part of the healthcare sector and as part of the Department of Health family.
I would like to congratulate not only the finalists who again presented their ideas today, but also really highlighting all 15 ideas that were so innovative, very inspiring. No? We always say that you are the frontliners, you are in the trenches. But more inspiring than the innovation, the innovativeness, is the continuous courage to hope. That, I think, is your superpower. And the grand prize winner of the first ever Health Governance Hackathon is from the Zamboanga Peninsula, One Blood Sample Source System.